The pain is in control, you know, I'm not in control of the pain.
That must be quite tough.
Yeah.
And are you sexually active?
I think so.
Yeah? You think so? You know so?
As I'm touching you, can you feel me touch?
I don't like it.
You don't like it?
I don't like. No, not nice feeling.
I'm just concerned that maybe the lining of your brain is a bit inflamed. So I think we need to send you to A&E.
Okay.
I see lots of patients who have really difficult lives, and I've always felt really humble with how people do the best that they can for their families with sometimes really limited resources. I like to make every patient feel a bit special that comes in to see me. I like to listen to the story and let them know how well I think they're doing. Hi, is it Clarissa Cupid?
Yes, it is.
Hi, in you come, my love.
Thank you.
Take a seat.
Thank you.
What can I do for you today?
My family and I have been on holidays to Turkey on holidays.
Oh, lovely.
We flew back this morning. We got back in about 4 o'clock. But whilst we were over there, we had food poisoning. And I'm still having some symptoms. Last night I had to take Imodium still.
Right.
So I thought, you know, let me just come and...
Best to come, yeah. Do you know you must have eaten a meal or something, mustn't you?
We're not sure if it's the meal or if it's the water.
Right.
Because sometimes we drank water which wasn't bottled.
Right. Did you have to go into hospital or like an urgent care?
No. We were about to check out. We couldn't check out. We
Yeah.
were still using the room.
Yeah.
They called the doctor. So the doctor came and the nurse came, did an assessment, and they put drips. We got drips, everything. Oh, everything. I've never seen that done
I've never even heard of that in
before.
my
Where they
life.
just got the tape and stuck the IV up on the wall.
Hi, Mr. Dalziel.
Greetings to you.
I'm
How are you
Dr.
doing?
Khan, come through. Yes,
you.
I'm very
See you in a
well,
bit.
thanks. Looking very smart.
Oh, thank you very much.
Giving me a run for my money.
No, I had to make the effort. Because when I heard the name of Mia Khan, I was thinking, oh, the boxers. Yeah.
Oh, behave yourself. Everybody's always disappointed when they hear...
No, I'm actually impressed instead.
Normally I go to a restaurant and they hear my name and they give me the best table and then
This
they
is the
see
thing.
me and they're just like, this is not who we were expecting. How are you, Mr. Dalziel?
Could be better. My right toe looks like a twig.
How long has it been going on for?
To be honest with you, it's been going on for a fair bit. Recently, when I was tidying up, my daughter says, you look weird. You look like a caveman.
Okay.
Yeah, it's time
Charming.
It's time to go and see the
Yes.
doctor. Exactly.
Is it painful at all?
No, but it's uncomfortable.
Yeah. We'll have a look at it and then see, shall we?
Exactly.
Let me just pop a pair of gloves on. Right, which foot is it?
It is the right one. Right, it's just this
Okay,
one.
yeah. It looks like a fungal infection. It's actually on your skin as well here,
Yeah.
which is what all this kind of dry, flaky skin is. Just lift your foot up for me. Yeah. Okay, so I'm going to give you a course of tablets to take. This bit of the nail that's already blackened and damaged, that's permanent.
Okay.
So what will happen is the new nail that grows from the bottom will come out clear. And eventually that will just grow out
disappear.
and push out. It takes a bit of time. We'll give you the tablet to take one a day, and it should
sounds like an
sort
idea.
all this out.
Yeah, because that flaky bit as well, because I can't take off my socks in the presence of anybody respectable.
See, I must be very disrespectful.
Yeah.
Right. I'll give you a prescription for
this, yes.
It's a tablet take once a day for 4 weeks, and then you stop it. Once the bottom of the nail is clear, you'll see it, and that means
just
the
start
infection
disappearing.
is sorted.
Oh, fantastic.
Yeah.
You've done a
Is
good
that
job.
all right?
Oh, no.
Better
that's
than
me
the
done for
boxer.
day. I think so.
And let me get the door one second.
Thank you very much. You even get the dough, so which
There
is
you
even
go.
better.
Listen, lovely to see you.
Thank you very much
Cheers.
for the
I'll
help.
sort those bits out.
No problem.
Take care.
Cheers.
Bye-bye.
And was the diarrhea horrendous?
Yes.
Were it many times a day?
Many times.
More than 10?
More than 10, I would say.
Nearly all the
constantly
time.
going. We were dehydrated, I would say.
And were it really forceful? You know, you had to go straight to the
explosive.
toilet, explosive. It's not nice, is it? Oh, my goodness me. I bet you've never been as glad to get off a plane, have you?
Well, I couldn't get on the plane. That's why they treated us. I said, I'm not travelling like that. So,
Oh, blimey. So most of the diarrheas that we get when we're on holiday or when we're here are self-limiting.
Yeah.
And that means as long as you don't get dehydrated, you get better on your own.
Yeah.
There are a couple of things where if we see them grow in your poo, we treat you with antibiotics if you're still symptomatic. So it's likely that these samples will be clear, but it's best to do them just for completeness so we can say this is okay.
Yeah.
Yeah.
Exactly.
Are you happy with that?
I'm happy with that, thank you.
There'll be a form in a bag and you just drop it into surgery.
Okay.
There's a little spoon in the top of the thing.
scoop it.
Scoop it up and we need about a centimetre. At least it's horrible in there. We need a centimetre in the bottom and then the results take a few days. But another thing I noticed on your record is you've done really well with your HbA1c, haven't you? That was like a pre-diabetes
That's right.
thing, yeah?
And I've started trying to lose weight.
Yeah.
And I did lose some weight. And I think the last results I did was reduced. It's still borderline, but
I thought it was excellent.
Yeah.
When we do this HbA1c blood test, which is your blood sugar over a 3-month period, and your result in April was 43, it means you could be on your way to diabetes. Yeah. And when you had it done last month, it was 39.5. So that's in the normal range. So your hard work has really paid off.
Yeah,
and I think you
holidays
deserve a
ruined it.
pat. I don't know, when you ended up with diarrhoea, you might have lost a stone. It's been lovely to meet you. And has it put you off going to Turkey?
No, actually, because the people there were lovely.
Oh, it's gorgeous,
they were
isn't
quite
it?
responsive.
And these things happen, don't they?
Of course,
Yeah.
of course. Okay.
Okay,
Thank
lovely to
you.
meet you.
Lovely to meet you too.
Bye-bye. And you've got the best name today. Cupid. Gorgeous.
Thank you.
See ya.
Bye.
So last Monday, I had a procedure. They were taking blood samples from my left and right adrenal gland
Okay.
to see what gland is causing me my high blood pressure.
Yes.
Since then, I am feeling pain, you know, on my right side and even on my right testicle.
And when did this pain start?
To be honest, yesterday.
Yesterday.
Yeah.
Is it swollen at all? Have you noticed any
No,
lumps
I
or
think
bumps?
no, I
Not-
think it's not swollen.
Okay. And are you sexually active?
I think so.
Yeah? You think so? You know
Yeah.
so, you are.
Yeah.
I know these might feel like embarrassing questions, but whenever
No,
we just
it's
have
okay.
to ask them. Do you have a regular sexual partner?
Yeah.
Yeah. And has that changed recently?
No.
Same one as before.
Yeah, same one since 20 years ago.
Okay, fair enough. Fair enough. Are you worried that this is anything in particular?
We're always thinking the worst, yeah?
Yeah. Tell me what you've been thinking about.
Can be a tumor, yeah?
Whenever you're having any medical procedure done, the worst bit is the waiting for results part, because you don't know what to expect and you don't know what they're going to tell you. So it's normal to feel worried as you are. Adrenal tumours are one of a long list of causes that can affect your adrenal glands, and they're not the most common cause. You've had problems with your adrenal glands for some time. They're worried about them not working as well as they should, due to something called adrenal gland insufficiency. Have they explained all of that
Yeah.
to you? What do you understand about that?
I know that we can live just with one, they
Yes.
say.
So the adrenal glands, they sit very close to the kidneys, almost on top of the kidneys, and they help control things around your body. And one of them is blood pressure, one of them is how well your kidneys can filter salts. What the specialists at the hospital think you have are adrenal glands that aren't producing enough hormones. And I suspect they've taken a biopsy to try and find out
Yeah.
why that is. And what about your testicles? Have you thought about anything that...
No, just now I start having that pain. I don't know if I'm sore from the procedure. Yeah, can be.
Yeah.
Because you can have internal bleeding or hernia if you. So I don't know.
Should we have a feel of your tummy? Is that okay?
It's okay.
Yeah. We'll put a mask on for this just because I have to get a bit closer to you. And if you just lie down there for us. If you just put your hands by your side there, that's lovely, and just relax your tummy for me. If it hurts anywhere, let me know.
Yeah, it hurts there.
It's pressing, yeah. And on this side, does that cause any pain at all?
No, no.
Would you mind if I had a feel of your testicle?
Yeah, okay.
Is that okay? We'll just draw this round. That's sore to touch. Is that sore there?
Yeah, it hurts.
Okay. And just take a cough for me. Okay, thank you. I'll let you come out when you're ready. Okay, come take a seat, thank you. So the good news is your tummy feels nice and soft. There's no lumps or bumps in the tummy, in the groin area, nothing in the hernia area. My feeling is this is trauma from the procedure that you had done. With the testicle itself, because it's tender to touch, that I think is separate to the pain that you get in there. I think you've got a condition called orchitis, which is inflammation of the testicle lining. It's usually caused by bacteria. It's not a sexually transmitted illness or anything like that. It's an infection that can just happen to anyone. And I think with a course of antibiotics, we can settle that down quite nicely.
Okay.
Is that all right?
Yeah.
So I'm going to give you a prescription for some antibiotics, and your pain in your testicle, I expect it to settle down within 2 days of starting this course.
Okay.
Yeah,
Okay.
all right. Any questions you'd like to ask me at all?
No, it's okay.
All right. Thanks
you.
for coming in. Nice to see you. Cheers.
Nice to meet you.
You too. Take care.
you.
Bye-bye.
Thank you so much.
Right.
In the morning, I just a little bit
Headache, is it?
yeah.
I keep getting migraines.
Okay.
Burning eyes.
I used to get headaches that lasted 3 or 4 days.
And I've been re-diagnosed with cluster headaches.
How did it start?
I think it might have been a lot of stress.
Right. Because I think this headache has been quite debilitating for you. Am I right to say that?
It has. I'm completely debilitated.
At one moment, it's like I lost control of my eyes. They were like spiralling. I had to keep blinking.
Have you had your eyes tested?
No, I have to go to eye test.
Any particular reason you haven't picked your glasses up?
There's been just a lot.
How can I help today?
I've been having severe headache since Saturday.
Poor thing.
Yeah.
Since
Saturday
what time
evening.
is it? Evening, okay.
Yeah.
Are you someone who suffers with headaches? Do you
No.
Never?
No.
Did you feel unwell on Saturday in the day? Did it kind of build up or did it come?
all right. I was all right.
Okay, and have you done a COVID test?
No.
Okay, so that's something you probably should think about doing.
Cool.
Okay, the new strain of COVID can present in a myriad of ways now. One thing some patients are complaining of is very strong headaches.
Yeah.
Any sore throat, any sort of sinus symptoms? Do you feel achy? Do you feel fluey?
In the night, I feel achy and tired.
Mm-hmm.
So I've been taking cocodamol for the past 3 days, but
Has it made any difference?
no.
No. Can you put your chin to your chest?
Yeah, but that hurts behind, like a full headache, yeah.
Okay.
Any severe movements of the head is causing me.
Okay. And are you feeling dizzy at all?
No.
Just because you haven't done a COVID test, I think it would be sensible to pop a mask on.
Yeah, okay.
Is that all right?
That's fine.
Just in case.
Thank you.
It worries me a bit that it's hurting to move your head around. Has it been like that since it started, or is that come on more?
Yeah,
okay.
yeah.
And does the cocodamol take the edge off it?
Just a bit, and then
But
it
not
comes
much.
back, yeah.
Okay. Apologies for this, but we just need to be sensible. We can in fact do a COVID test. Let's do that now.
How can I help you today?
Well, I've been away on holiday. A couple of days before I was due to come back, I started getting a bit of a cough.
Mm-hmm.
And it's become quite chesty, and it's just uncomfortable now.
Okay.
And I'm sort of like coughing, sort of like a light greeny lime catarrh type substance.
Where are you on holiday?
In Turkey.
Okay.
Yes.
And so the cough started a few days ago. Any other symptoms at all with it?
A little bit of a sore throat, but I think that's from the coughing.
Mm-hmm.
And generally, I just feel out of sorts.
Okay.
I did a lateral flow before I came here, and that was
That's all
negative.
good? Okay,
yeah,
great.
Yeah.
And anything you've been using for the cough or chest or anything so far?
No, I mean, I'm asthmatic, so I have my Foster
Mhm.
inhaler.
And the Ventolin, the salbutamol one, how much have you used that one in the last few days? With this?
I barely use that, to be honest with you. I mean, I carry that for emergencies.
Any pain or swelling in your legs at all that you noticed with all this travelling?
No, nothing. They're normal.
Good. Are you a smoker?
Of course, yes.
How much do you smoke?
Well, on holiday a little bit more, and I suppose that probably hasn't helped. But normally around 6 to 8 a day.
Okay. And has that been for quite a while that you've...
Oh, yes.
Okay, have you ever tried to stop?
I did, actually.
And was that just from willpower?
I have no willpower whatsoever.
Okay. And what about your partner?
My husband?
Yeah.
Yes, he does smoke.
He smokes?
He smokes.
Fine. We'll work on the both of you. Okay, fine. Let's have a little listen to your chest and see what's going on in there.
Sorry if I cough, because it's got quite random.
Don't worry. No problems. Let me just grab some kit. Hang on a second. Let's pop that on there. I'll give that a moment to do its thing. Can I ask you to stand up?
Yeah, of course.
And I'm just going to pop this on your back here.
Yeah.
And you've got a perfect top, very easy for me to do. So nice, big, deep breaths in and out for me. And out. Okay, well done. So 97 it goes up to, okay. 98, okay, great. So it's really noisy in your chest.
Yeah, it will be at the moment.
Asthma something you've had since you were younger?
Yes.
And have we ever reviewed that and wondered whether you might have something now called COPD?
I've been told that if I continue to smoke, I will probably end up with COPD, which hasn't stopped me.
No, I understand.
And I mean, I'm 61, nearly 62 years old, so I'm quite an active person, and it doesn't stop me.
No.
You know, so...
Listening to your chest, it's really wheezy everywhere, which sounds actually a little bit more as a COPD kind of picture, just from the way that you're breathing at the moment. When you've had kind of flare-ups before then, have you had steroids and antibiotics or just the antibiotics?
Just the antibiotics.
Yeah, so I think you need the steroids today, listening to your chest as well.
Is that prednisolone?
Prednisolone, yeah.
Oh, that's it.
That's the one, yeah. So I'll sort out a prescription to go there. So you're going to have the steroid tablets and the antibiotics that will go with it. See how things go, and then we'll get you back kind of at the end of the month, and then we can go from there.
Yeah.
All righty, I'll get that prescription through to the pharmacy for you now.
Okay, perfect. Thank you very much.
Hope you feel better
Thank
soon.
you.
Take care. Bye,
Thank you,
Patricia.
bye-bye.
Thanks, Patricia. See you soon.
Thank you. Bye-bye.
If you're unable to move your head without it hurting,
Yeah,
I think you should really be in bed.
Yeah.
Because viral headaches and viral meningitis, I know that's a scary word, but can sometimes present a bit like this.
Yeah.
It's quite high. Have you ever had high blood pressure before?
I had it when I had a chest infection. That was the time first time I had pressure high.
So there's two things I think. One is, you've got this acute headache. What is going on? Is it a viral headache? Or is it related to potentially to your blood pressure? That's the worry, okay? It's not a dangerously high blood pressure in the sense that I would need to lower it immediately, but it does make me wonder whether there may be some link. But when I got you to put your chin on your chest, it just feels like it's pulling, does it?
Yeah.
Okay. You know where I'm headed, don't you, with this? I think we might need to get you checked out in hospital. For a second. Just let me just look at your pupils. Look at me. Any blurred vision at all?
Blood in no.
So I think we probably need to get you checked out in hospital, just to make sure that this isn't a meningitis type picture. You haven't got a temperature. You're having some difficulty moving your head around. You've got a stiff neck when I get you to look down. I'm just concerned that maybe the lining of your brain is a bit inflamed. Now, that can happen because of viruses as well as because of bacteria. And it's, it's not something that's long-term serious if it's a viral meningitis, but it does need to be looked at. And you're a fit and healthy man normally. This is not normal for you, is it? There is still a possibility it could all be COVID. COVID does a weird and wonderful thing to people, but the test is negative at the moment, so we can't put it down to that. So I think we need to send you to A&E.
Okay.
Which I know you don't want to hear, but I think
Yeah,
we just
go.
need to rule out the serious things. Okay. What I might do is ask you to sit back in the waiting room just for 2 minutes while I quickly write what we've done. All
Okay,
right.
not here, so there.
Yes, just take your time. Walk over steadily. Are you okay to walk on
Yeah,
your
I'm
own?
fine, yeah.
You sure?
Yeah, very fine. Thank you.
Hey, listen, how long has Francis got left before this baby arrives?
5 weeks.
So you're a granny?
Till I'm a granny.
What are they going to call you? Grandma or Nana or what?
I don't want to be nanny, I'll be grandma. Grandma Deb.
Grandma Deb is quite cute.
It's quite nice, isn't it?
Yeah. What are the other options? Nana?
Nana. No, I don't.
Can't be
it
Nana
reminds me of
because...
the dog in Peter Pan.
Hi, is it Cassandra coming in? Oh. Come and have a seat. I'm Dr. Ramshaw. Oh dear. Tell me what I can do for you.
Since Saturday, my shoulders hurt. Well, it started in my ribs Friday.
Yeah.
You know the bars an old person has to help them sit up and things, the
Yeah,
white bars?
yeah.
I leant over one of those. Then my ribs started hurting. And I thought, oh, that's all right, it's just probably bruised. I could deal with them because I knew I'd had major heart surgery a year ago, so I knew that was gonna, possibly because I'd leant on the scar. And then Saturday morning I've got up and all my left side just hurts. I can't sleep. I've had enough now.
Oh, bless you.
Do you feel more tired than normal?
Just very tired most of the time.
I'm finding it really difficult to sleep.
And at night time in bed, it's like having toothache in your knee.
I've gone to bed feeling pretty normal.
When I was laid in bed, it felt like I had a collar pressing around my neck.
I wake up, I thought, what's going on here?
Does it keep you awake at night at all?
Trying to get in a comfortable position is quite difficult.
I don't go to sleep and it takes me forever to get off to sleep.
I'm learning to sleep.
You look really tired.
Oh, I feel like I could fall asleep, literally.
I've had probably about 3 hours sleep.
Right.
Last night was my worst night out.
Okay. So the bit about the bar, you were leaning over a bar?
Yeah.
Any reason you were leaning over the bar?
Trying to make a bed.
Right.
As you can see, there's a nice little scar down the front of me.
But when you did that initially, it was okay?
Yeah, it didn't.
Yeah.
It was just a bit.
Okay, yeah. And it was a day or two later?
It was a bit tender,
Yeah.
which is understandable because its scarring's still pretty new.
And what surgery was it you had?
Major heart surgery.
Yeah.
I had an aortic valve replacement.
Okay. So that's a big thing.
Yeah. As I say, I think what I've probably done is where I've leant on that.
Okay.
I think I've just probably pushed
Yeah.
bits into ways I shouldn't be going. I think I've probably just tensed up and this has now gone to a point where I can't deal anymore because I can't lay on it. I can't lay off of it.
Yeah.
Can't lay on my back, can't lay on my front.
Okay.
And I'm like, oh, God's sake.
So there's nothing else you can think of that's brought it on? No other activities or exercise or anything like that?
I was at work yesterday.
Yeah.
I didn't lift anyone.
And what job do you do?
I'm a care assistant.
Right, okay. And any temperature at all
No,
that you've noticed?
37.1.
Right, okay, you checked it. Okay, fine.
And I've done my blood pressure.
Okay.
I've done a COVID test.
Well done, and that was negative, I'm assuming.
Yeah.
Well done. Right, so if you stand up, let's have a look at you. So drop your arms down. Where's the pain?
It's in here.
Yep.
But it also gets in here.
Right, okay.
So it's like there.
Okay. Actually, we will slip this off if that's all right. Yeah, okay.
Oh, yeah.
So I'm just going to feel around your shoulder. Is that all right? That's tender there?
Mm-hmm.
Okay.
Mm.
And at the front as well.
Mm.
Okay. Any bruising? Do you mind if I have a little look? If you come behind the curtain. I'll just pull this around. Okay. Nothing to see. I'll just pull this up as well, if that's all right.
Oh, yeah. Ow.
No, that's fine. Okay. And let's just have a look at your shoulder movements now. So, right, up over the head if you can.
That one I can, but that one that's as far as I can go.
Okay, and then back down. Okay, fine. Come and have a seat.
It ain't going behind.
Yeah. So I agree. I think it's your shoulder problem, isn't it?
Yeah.
Why it came from leaning over, I don't know. But then often we do go into
a spasm,
a bit of rigidity. So what we need to do is get you out of pain.
Yeah.
And then get that shoulder moving. Okay. Stronger painkillers. Have you taken cocodamol in the past?
Yes.
And how have you got on with them?
Fine, it just makes me...
Bit nauseous?
No.
Constipated?
Yeah.
Yeah, okay, so do you have anything for that?
No.
No, okay. So what I'd suggest is giving you some strong cocodamol. So
Yeah.
you've got paracetamol and codeine in.
Yeah.
And take 2 up to 4 times a day.
Yeah.
Might make you feel a little bit nauseous, sleepy, but hopefully then you'll sleep at night as well. So I'd
Yeah.
definitely take 2 to go to bed. We can give you something to help with potential constipation as well, because they can bang you up a bit.
I don't really want that happening.
No,
'cause-
so let me give you some sachets, okay?
Oh, actually, I might have those, actually.
You've got the sachets?
Yeah, I think they've given me those.
Something like Laxido
Yeah,
or
Laxido.
Morbico. So do that, and then what you need to do once you're out of pain is start doing some shoulder exercises.
Yeah.
You can look on a website called Versus Arthritis. You haven't got arthritis,
No.
it's just good for exercises. These sort of things can take a little while to get better, sometimes a good few days to a couple of weeks. You're probably not able to work initially, do you think?
No.
No. So take the next few days off, okay?
Yeah.
Hopefully then it'll be better.
Yeah.
And if it's not getting better within a couple of weeks or getting worse, then do come back to us. All right.
I'm glad when it's gone.
Go and have a nice hot bath in the meantime.
I've tried that.
No, okay.
I just want to sleep.
Yeah.
3 hours sleep isn't fun.
No, well, hopefully you'll sleep better tonight.
I hope so. Thank you.
Okay, well, nice to meet you. Let me get the
Thank you.
door for you.
Yeah, I'm hoping my arm will let me
Yeah,
move
be
now.
careful.
Thank
Okay,
you.
all the best.
Bye-bye.
Bye-bye.
Thank you. Enjoy your day.
Oh, I'm sure I will.
How old are you?
How old do you think I am?
No, don't make me do that. Devs, how old do we think Jamie is?
23.
What's your guess?
22.
21.
21?
I was born in 2000.
Millennium baby.
People born in 2000 now, Devs, are qualifying as doctors this year.
Oh my God.
I know, that's nuts, isn't it? He hasn't heard of Chitty Chitty Bang Bang, Debs.
I've heard of it, I've just not seen
You
it.
better get watching that, because if not, the child catcher will come and get you.
Yeah.
Mr. Goodman.
Yes.
Hi, Dr. Taylor, come through. Have a seat.
Okay.
How can I help you this morning?
I've done something to my knee.
Right.
I'll just give you a little bit of
Yeah, of
background.
course.
I was in the United States Air Force.
Mhm.
Had a lot of injuries to it. I had one meniscus repair and one meniscectomy.
When was that?
2008.
2008, okay, so
Yeah.
kind of 14 years ago. Okay, and was that in the States or was that here?
Yeah, it was in the States.
Okay.
Things didn't go too well, you know, because I was supposed to be able to
Left or
recover.
right?
Right knee.
Right knee,
I was supposed to be able to recover and keep, you
Keep
know.
working?
Yeah. But
Okay.
it resulted in me being discharged from the Air Force.
Oh, okay, I'm sorry.
Because I couldn't run. And
I'm sorry. That's hard. Yeah, really hard.
I know. I've been, you know, taking it easy on it for a long time.
Yeah.
And recently I was helping my son look after his brother-in-law's dogs, and I think something went a bit wrong. It felt like something got squashed or popped, and then there was no response from the knee for a little bit. And that was just yesterday.
Yesterday, okay.
Yeah, so it was
it's
in the
really
morning.
Acute, sure. Have you had any episodes prior to yesterday with the dogs where it's felt unstable?
Yeah, a lot.
Have, okay. So do you think it's been worsening a bit?
Yeah, because I don't know how much meniscus was left, and I don't know how damaged it really was.
Was it done by Air Force surgeons?
It was done by a private surgeon in Texas.
When did you move from the States?
In, what was it, July 2009.
What brought you to England?
My wife, she's from Swindon.
Oh, okay.
So I was stationed around here.
So you've never seen an orthopaedic surgeon here?
No, not for my knee.
For your knee.
No.
Okay. What about the rest of your health?
Not too great.
Okay, I'm sorry.
Yeah.
Tell me.
I've got a, what is it, pars defect. I was a munitions handler, so...
A lot of heavy lifting.
Yeah,
A lot of
heavy lifting, yeah.
yeah. Gosh, yes, so your bones have taken, you've taken the hit, haven't you?
Yeah.
And have you ever had any sort of specific physiotherapy for you?
Every time I go, they're just kind of like, oh, you're like kind of too injured for us to really do much. And then.
Okay. Do you take any painkillers regularly?
Pregabalin.
And does that help? That's for the back, presumably.
Yeah. I mean, it helps. It helps a little bit. I guess it helps with
sleep.
Yeah, sleep, anxiety, stuff like that.
And are you working in a different role now?
No, with my back the way it is, I haven't been able to keep a job.
Difficult, really difficult. Yeah. And so does the back kind of flares and
yeah.
Up and down?
The pain is in control, you know, I'm not in control of the pain.
Yeah, that must be quite tough.
Yeah, it has been tough. It has been depressing at times.
I'm sure. Was your intention to stay in the Air Force?
Yeah.
Till the end.
Because I was there, 11 years, and then my body was completely destroyed, and and then civilian life didn't work out so well because of the
limitations of the pain, of course. You've got British citizenship.
I don't have British citizenship, but I mean, I'm a indefinite leave to remain because I've lived here.
So we can refer you to specialists on the NHS, which is the beauty of this country. So we can get you seen by the right people. It feels a bit like you dropped off the review list.
Yeah, I think so. It's been going on so long, and there's so many different complications.
Exactly. Let's have a look at this acute thing that's happened. Can you hobble onto the couch for me?
Yes.
Poor thing. Take your time. Right, relax your back down there. Get your legs up the best you can.
Yeah.
Okay. Yeah, you can feel there's some fluid in there, definitely.
Yeah.
Right. Bend it up gently. I don't want to make it sore, but let's just... I'm sure you've had this done before. I'm just going to do the good one first so I can feel what it should feel like. Okay. Yeah. So this is obviously just feeling your ligaments. Okay. I'm going to just do this once. Okay.
Okay. Yeah, that's not
okay. So painful when I do that.
Yeah.
But not giving way actually, which is good. Now this one, I'm really sorry, but I just want to just once. Okay. That really sore.
Yeah.
I think ligament-wise we're all right.
Yeah, that's good.
It's obviously just the meniscus now. This is the bit that's going to hurt you a little bit, and I'm really sorry.
Okay.
Bend your knee up for me, but just relax it.
I'm trying to relax.
You can't. No, I'm just, I've said that now.
Oh yeah, that's not the movement.
I'm not going to do that anymore. Clearly, your meniscus is not happy at all. Right, we need you seen by a knee specialist, don't we?
Yeah.
But I think we will also make a referral back to the back specialists. Okay.
Yeah. Okay.
In terms of pain relief, do you want me to give you anything more at the moment, or do you feel like you've got enough in the cupboard and you can manage it? You know what you're doing with your pain.
Yeah. I think I've.
We do have a physio here on Monday. We could get them to assess you for what it's worth.
Mm-hmm. Yeah, that might be a good idea.
Yeah, why don't we do that? We can fit you in to do that.
Okay.
All right, I'm sorry, it's not going to be a quick fix, but I feel we can definitely get you better than this.
Yeah, I know there's no quick fix after.
And after going through what you've been through, no, I'm
Yeah,
sure. So I will do both those referrals and get that sorted for you, and we will book you into physio on Monday.
Okay, great.
All right.
Yeah.
Lovely to meet you.
All right.
Fingers crossed we can get you a bit better.
Yeah.
Jamie, could this gentleman be booked in for physio on Monday, please? That'd be great, thank you. Nice to meet you, take care.
Thank you.
Bye-bye.
Perfect. Let me have a look at the schedule. 9:50 or 11:10 or 11:50?
9:50 is good.
9:50 is good? Perfect.
Yeah.
I'll get you booked in. That's all good. And we will see you on Monday.
Okay.
Brilliant. Thank you so much. See you Monday.
See ya.
Tell me what you've come in for today.
Right, I've come in because I have trouble coping sometimes. I am on some antidepressants.
Yeah.
The main reason why I have trouble coping is my husband has cancer.
Oh, I'm sorry.
Bowel cancer. He was also diagnosed with a lymphoma. Coming up to the 5 years, he had the bowel screening, which came back with a problem. And the cancer is back.
Oh.
So now he's back on chemotherapy again, and the operations aren't happening because they can't cure him now.
Right.
I don't struggle every day, but I do struggle some days. And what worries me most is what's going to happen eventually, because I know it will happen eventually. But when I try and think of the future, it looks very bleak.
Shall
we just have a look at these feet?
Yeah, they're not the prettiest feet in the world, but...
I don't think anybody's got pretty feet when you get over that far.
I always get a whitlow on my toe.
Right.
Is it all over the feet? Where is it on the feet?
There.
So it started in your big toe?
Yeah.
Was it even redder and hotter when you first started?
I noticed a little lump, and then all of a sudden it's just growed straight out.
Right.
It's been very painful.
Okay.
It first started here.
Yeah.
And then it moved over here.
Right.
And the pain has been over here.
There's his little toes, aren't they lovely? Yeah.
I'm going to do a couple of different toes.
It's always this one.
I'm all right to put my sock
Yeah,
back
get your sock back on now.
Hi, nice to meet you both. Great. So how can I help today?
Right, I have big problem with my back. I've got an injury, I've got a damaged disc, I am after operation. And because of this, I always has a problem with my right leg. I'm limping, I can walk just a bit. My leg is very often numb and painful. But from yesterday, I've got something like that. Yes.
Okay.
And I have no idea why.
No injury, no.
No.
Yesterday was Tuesday. So what were you up to on Monday?
Oh, we've done shopping. Shopping. That's it.
Fine. And nothing obviously happened to it. Because this kind of thing looks like something should have dropped from a great height on it or something. Yeah,
I know.
But that's not the case. Okay. Pop yourself up on the couch for me, and we'll have a bit of a closer look.
It's very natural to think about those things, and I think you're coping with it remarkably well. The fact that you've been able to tell me all of that.
Talking about it, I find helps.
Good.
I've got no family nearby. We bought a puppy, but I've ended up doing all the training and everything because he's not fit enough.
And it's a lot of work.
He can't even take her for a walk.
Let's focus on you for a little bit. So, you know, again, being upset, being tearful, completely normal. Was there anything you were hoping we might be able to do?
Well, as I've had to give up work, I have no income. My husband's on a state pension. And with the way the cost of living's going, I'm afraid that we're going to struggle in the future.
Yeah. Are you getting nothing at all at the moment?
Nothing at all, nothing.
Okay. Have you thought about a sick note for this period of time? It's not a case of going back to work.
I'm not employed. I was made redundant during the...
It doesn't matter. So I can give you a sick note for, let's say, 3 months, and you could get statutory sick pay over that period. Then we can renew your sick note at the end of that period.
I didn't realise that was a possibility.
It's not a great deal of money, but it's better than nothing at all. I think you're doing a lot of the right things already. And the walking of the dog, not only do you get outdoors and get the benefits of that, but you've got the exercise factor as well. And you've got the companionship of the puppy too. I think talking to your friends is really important, particularly if you don't have any family around. Where are your family? If you don't
all over in Kent.
Okay. The medical note will help and it will take some of that financial pressure off. But remember, this is because you're not well enough to work and you mustn't feel guilty about that. And so we'll sort that out.
But we do, don't we?
We do, but you've got to keep telling yourself that you have worked and you were made redundant and now you've got some serious mental health issues as well as supporting your husband, which makes it impossible for you to work. And that's what these notes are for, and it's completely fine. And then I will send you the number for the talking service at the Macmillan Centre, and they are brilliant because it's very specific to what you're going through.
My biggest worry is my husband's health, and you tend not to think about yourself.
Yeah. But it's important you do, because if you're going to be well enough to care for him, we need to look after you as well. You're doing brilliantly. I don't think you're giving yourself enough credit for how well you're doing.
It's tough.
And it's okay for it to feel tough, and it's okay to have a cry, and it's okay to want to take a break from it as well. Has that been helpful for you to come in? It
has been very helpful. Thank you. Thank you so much.
My pleasure. It's lovely to see you.
And you.
All right, my love.
Thank you very much.
My pleasure.
Thank you.
Bye-bye.
Bye.
Thank you so much. Have a great day.
That's okay. Yeah, you too. Thank you.
See you soon. Thank you.
Bye.
As I'm touching you, can you feel me touch?
I don't like it.
You don't like it?
I don't like. No, because it's numb.
It's numb.
It's annoying me.
It's an irritation.
Yeah.
So you're aware of something happening there, but it's not a proper feeling.
No, it's
Yeah.
not. It's
Yeah.
not. It's much different. You can touch
Yeah.
my
So this,
left.
if I touch you
it's
there,
fine.
you don't mind. You can
Yeah.
you can feel me touching you, but it's
It's
a different
annoying,
sensation
yes.
to that side.
Not nice feeling.
Yeah. Okay. I'll try not to do it too much. Okay. Fine. I just want to have a little look. And you were saying
this is pain already.
You were saying
The
it was
bottom.
kind of sore
Yeah.
underneath. So I'm sorry. I'm just going to prod it a lot.
And then more pain.
more.
Yeah.
And tell me a bit about the background. So you had an operation.
Yes.
And it was on your back.
Yes, it's
Yeah?
a low back.
Mhm.
Yes, I had a damaged disc, so they removed the disc because the disc pushed very strong my nerve.
On the nerve.
Yeah.
And how long ago was it you had that operation?
3 years ago.
Yeah.
Okay.
3.5, something.
Did it help having had the operation?
Yes, with pain.
And are you under the care of anybody for the leg in general at the moment still, or
No.
no? You had your surgery and
Yeah.
this is where we're
Yeah.
at now. And
Yeah.
you're on some painkillers.
Oh yes, I
Yeah.
am with tramadol, naproxen, and amitriptyline.
Okay.
Every night.
And you use that regard. That's
Oh.
kind of a regular thing that
Yes,
you're having
yes,
to take.
yes,
Yeah.
yes.
Okay.
If I don't gonna take medication, I obviously can't get up from
Yeah.
bed in the morning.
Okay. Have a seat for me. I don't think there's anything serious. It's obviously a bit peculiar. I think bruising can always look very dramatic, particularly when it's on your foot. So if it was somewhere else on your body, you kind of move around and gravity helps to get rid of it. Whereas on your foot, it's kind of right at the bottom. It's going to take a little time for the bruising to kind of break down and shift. I guess because your sensation isn't quite normal there,
Okay.
whether you've worn some shoes and not necessarily felt. Whereas if you'd had it on the other side, you may have been
Yeah.
like, oh, this is too tight or something else
Yeah.
like that. So I think it's just bruising.
Okay.
I think it will just
Okay.
go away. Elevate it as much as you can. And I know that sounds really difficult because you're busy.
Yes.
But kind of foot up. Have your husband here bring you everything you need.
Thank you for that.
Sorry.
Much appreciated.
and then hopefully the bruising will just settle down and that will be the end of it kind of thing.
Okay, so just relax and
Yeah.
a
That's
little
it.
bit rest. No
Perfect.
problem. Okay.
Thank
All
you
right,
for your
have a good
help.
rest
Yeah,
of your day.
thank you. Bye-bye.
Bye.
Thanks for that. Okay, bye-bye.
You see, no gangrene.
Thank you, sir.
Take care.
Have a lovely one,
Thanks.
sir. All right, cheers. Thank you.
Lovely to meet you as well.
Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye. Have a good day.
Alrighty.
Lovely.
Any problems, give us a call.
Cool.
Thanks for coming in.
No, thanks for seeing me.
No problem. Take care.
Yeah, see you soon.
Bye.
Cheers.
I love seeing patients in person. I think it's a really lovely experience and it helps me really get a full flavour for what is happening in that person, which you can't get when you're on the phone or doing an online consultation.
I just don't feel normal at the moment. My body just doesn't feel
Don't feel right.
No.
Yeah.
It's completely, well, ruined my life, to be honest, because I can't do what I want to do.
I've got like a sore come up on the end of my penis.
And it's not sore if I press up here.
It is.